Hello friends, how are you? From now on, I want to focus on nursing diagnoses and I want to share some explanations about all of the nursing diagnoses created by Nanda. The first one is about activity intolerance. Activity intolerance is one of the nursing diagnoses that has created by NANDA, North American Nursing Diagnosis Association, and I want to share the definition, factors, and also about assessment, characteristics, interventions, and at the end, I want to say something about the education that patients should get by the nurses and also how it would be useful for you nurses and other healthcare workers. So definition of activity intolerance. The definition is insufficient physiological and psychological energy to endure or complete required or desired daily activities. The daily activities, the routine daily activities that the people should do for their self, for example, about eating, bathing, dressing, transferring, toileting, and walking and moving around, these daily activities, if someone can do them, it's okay. But if not, it should be done by patient, or if possible, it is better to be done, to be performed by patients and also by the nurse. And a collaboration should be maintained between nurse and patients and also engage the caregiver. Caregivers can help the patients to do daily living activities and also about it is the main purpose of nursing is the patients being independent for doing everything for themselves. So, related factors to activity intolerance is generalized weakness or debilitation related to acute or chronic diseases. These diseases like cardiovascular, diabetes, and pulmonary disorders, they can activity intolerance. They can create the activity intolerance for patients. Because, for example, as you know, any activity needs oxygen, and if oxygen should it's if oxygen if we want to oxygen be provided to patients, cardiopulmonary, cardiovascular, and also pulmonary systems should works properly to reach the oxygen to the organs to have a great and appropriate and acceptable activity. Aging process also creates some weakness and fatigue. So the aged people, the elderly people have some activity intolerance. It is natural. And we can do something for them that in continue I will share some explanation about the intervention we can do for activity intolerance. Obesity is one of the factors. Malnourishment and malnutrition is one of the main factors for activity intolerance, even in people and also among the patients that are hospitalized for some intervention like surgery or internal wards and so on. Anemia is another factor for activity intolerance because if someone has anemia, so the oxygen could not reach to the organs because the organs needs oxygen to work properly, to work normal and in a normal and natural ways. The side effects of medications like beta blockers, calcium channel blockers, and so on make some activity intolerance. So It is more important because the cause of activity intolerance may be related to is related to the medication. Emotional state like depression, severe anxiety also can create activity intolerance. Sedentary lifestyle. Those people who have sedentary lifestyle, they have also activity intolerance because the weakness in the muscles and also in their bones. So they have sedentary lifestyle. About insufficient sleep and also rest. This is another factor for activity intolerance because rest and sleep is more important. Those people who do not sleep at night based on the circadian rhythm, they will have a weakness and also the immune system will reduce. So their activity would be compromised, and also about uh, they have a weakness in muscles and also bones, and also they have a compromise in immune system and so on. Hope. Okay. Characteristics of activity intolerance. The characteristics of activity intolerance, first is verbal report of fatigue or weakness by patient. For example, the patient or someone says that he or she has fatigue or weakness. The second is unable to endure or complete desired activities, about daily activities or any activities, for example, doing exercise, walking, eating foods, and so on. It is another character of activity intolerance. Another trait is abnormal heart rate, blood pressure, or respiratory response to activity. Someone wants to do the activities, but the heart rate will be increased, and blood pressure would be high, go rise. And also about respiratory, they have the normality of respiratory pattern will be compromised, and also they have irregular respiratory rate. Uh, and another character is exertional discomfort or dyspnea. Discomfort means someone by exertion, by activity, has nausea, vomiting, chest pain, and also someone has dyspnea and so on. These characters are the main and more common characteristics of activity intolerance. Okay, in nursing plan, we have some expected outcome for activity intolerance. These outcomes are depends on the patient's situation. For example, about an ICU patient that is fully dependent to the nurses and healthcare workers, the outcomes are different than those people that are just educative. They are working, they are doing their work, and also hospitalized in general units in the hospital. Okay, but in general, if we say the outcomes, expected outcomes for nurses, so the first one is patient exhibit tolerance during physical activity. We have a scale. The scale name is Borg. We have this scale. It takes 0 to 10 rate. 3 or less is appropriate physical activity, and one of the main outcomes can be 3 or less number from 0 to 10 scale of Borg. And another outcome is heart rate less than or equal to 120 beats per minute, or within 20 beats per minute of resting heart rate. For example, someone before doing any activity, we check the heart rate. If by activity it reached to 120 or less, or the rising number of heart rate would be less than 20. It is okay. It is we have no problem with these patients. One of the expected outcome can be this outcome. Another outcome is systolic blood pressure within 20 millimeters of uh, mercury increase our resting state. Within 20 millimeters of mercury is great, but above it, the patients would get syncope and many problems like chest pain, palpitation, and so on. Another outcome is respiratory rate, less than 20 breaths per minute, no chest pain, and dyspnea. It is completely obvious. Another outcome is patient report the ability to perform daily living. The patient report this. It's okay. And the last one is the patient verbalizes and uses energy conservation techniques like resting, prioritizing tasks, nutrition, and so on. I will say them in continue the energy conservation techniques. Okay, now I want to come across the assessment of activity intolerance. How we check the activity intolerance, how the nurses check it. The assessment is actions and also rationals. First of all, we assess the patient level of physical activity and mobility. We check it because we want to have a basis for formulating realistic short-term and long-term goals. For maintaining and rising our goals, we need to check a baseline, a basic level of physical activity and mobility. Another one is determining the patient's perception of causes of activity intolerance. Sometimes patients give us more information about the causes of activity intolerance. These causes may be temporal or permanent, physical or psychological. So if we want to conduct a plan, a nursing plan for these patients, we need to know more about the causes of the problem. Our problem is activity intolerance. Another actions for assessment is assess nutritional status. As I said, nutrition status is one of the main factors of activity intolerance. Adequate energy reserves are required for activity. This energy comes, one of the resources of energy is nutrition and food. So we should check the nutritional status of patients. Another action is monitor the patient's sleep pattern and amount of sleep over the past few days. A sleepy pattern is more important. As I said, the sleeping should be maintained based on their circadian rhythm. Circadian rhythm is 10 p.m. to 6 a.m. It is great. But if someone sleep during the day, not at the circadian rhythm, we have a hormone named melatonin. Melatonin do not secrete in the body. So the patient do not go to the deep sleep. Deep sleep is more important for body recovery, for maintaining the brain freshness and also the brain activity. Okay, about the patients, evaluate the patient's routine and over-the-counter medication. As I said, one of the main factors of activity intolerance uh, is the medications. So the main medications are beta blockers, calcium channel blockers, tranquilizers, alcohol, and also muscle relaxant drugs can induce fatigue, and fatigue is the main factor for activity intolerance. Another assessment is assess the needs for ambulating aids. For example, someone use bracing, cane, walker, crutches, and so on. We should check it because if patients need them, we should give these devices to patients to have a good activity. Another one is the assess the patient's baseline cardiovascular status. The cardiovascular status, someone who has a low ejection fraction, less than 40% ejection fraction, we say heart failure. Less than 20, we say the compensated heart failure. Those who have the compensated heart failure, they can move properly. They have, we say, syncope, chest pain, and sometimes they get dysrhythmia. So it is more important to have a close monitoring for cardiovascular system, mostly by pulse rate and also blood pressure. We should check them. In continuous, we say assessment of activity intolerance. The actions are, another action is assess the patient's perception and effort required to perform desired activity. If we check the perception of patients, we can put our plan and we can do our goals and also make our goals based on the patient perception. As I said, the Borg scale is great, and if the patient get 3 or below is desirable for daily activities. Another one for assessment is observe and document responses to activity. How we should check it? The responses. Ineffective responses are changed heart rate higher than 120 or increase 20 to 30 pulse per minute. Palpitations. The palpitations indicates change is in heart rhythm. Increase or decrease blood pressure. 20 millimeter of mercury systole or 10 millimeter of mercury diastole is our target. If we change in the blood pressure, 20 milligram systole or 10 milligram in diastole, millimeter of mercury in diastole, the patients maybe would be compromised, would have chest pain, and also some discomforts. Dyspnea, labored breathing, wheezing, excessive fatigue, and weakness are other ineffective responses. Lightheadedness, dizziness, pallor, diaphoresis, and also chest comfort are another signs of ineffective responses. These responses would be a guide for optimal progression of activity. Another action is assess emotional responses to limitation in physical activity. Emotion, being motivated, have passions is more important to collaboration with patients, and the patient should be cooperative. So the patient emotional state is more important. Depression or inactivity and severe anxiety can be a source of stress, and they don't have enough cooperation with the nurses. Use portable pulse oximetry to assess oxygen saturation during activity. Some patients during activity, their oxygen saturation will be reduced less than 90%, so they would need oxygen supplement. So supplemental oxygen should be available if the saturation is reduced. This scale is the Borg rating of perceived exertion scale. As you see, until 3 and below is normal, and patients can have a perceived exertion scale, can have the activities easily and no problem. But above 3, we have some hardness or difficulties, and the 10 is the highest hardness for patients even for doing any activity. So, nursing interventions for activity intolerance. In this part, I go on the interventions. The nursing intervention is more important. First intervention is establish the goals and guidelines with the patient and caregiver. As I said, the patient should help themselves and also caregivers should help the patients. So we should establish or maintain the goals based on the patient's status or conditions. And if the goals would be unachievable, the patients would be disappointed. And it's not good. If we want to enhance motivation, the patient should have the actual goals for activity. So the first intervention is having a goals and guidelines. Assist caregivers for additional help to patients at home. This this is more important because the caregiver should be educated, and I will come across this note in the next slides. Encourage to adequate rest, especially before meals, doing ADLS, and also before exercise and ambulation. The rest provide time for energy conservation and recovery. Another one is refrain from performing non-essential procedure. At first, the patient should prioritize the task and do the more important tasks every day. So they need energy, and if they want to conserve their energy, they should refrain non-essential procedures. Assist patients with ADLs until reach dependency. As I said, the dependency would be attainable by helping patients, caregivers, and also nurses. The caregivers and nurses should help the patients until they reach the dependency. And for preserving energy and maintaining motivation, they need help. The patients need help. Encourage bedside commode as indicated. These bedside commodes help patients expend less energy than bedpan and going to the bathroom. But if they reach to the higher level of dependency, they can go to the bathroom too. Encourage physical activity consistent with the patient's energy resources. This physical activity depends on the patient's condition. For example, doing range of motion activity at bed or walking outside of home. Promote a sense of autonomy while being realistic about capabilities. The activities should be based on the patient's capabilities. Another intervention is assist patients with planning activity for times when they have more energy. For example, for example, the patient had a great rest, a great nutrition, and don't have any problems, and he or she has full of energy. So we can do some main activities like hygiene, cleaning, exercise, and so on in when the patient has more energy. Another intervention is encourage verbalizing of feelings regarding limitations. By sharing feeling or feelings, the patients can acknowledge physical and psychological intolerance, and it helps them to reach coping. Another nursing intervention is progress activity gradually, like for example, active range of motion exercise at bed and progressing to sitting and standing. Dangling the legs 10 to 15 minutes 3 times daily. And also deep breathing exercising 3 or more times daily. It would helps them to maintain their respiratory uh, capacity, and also it helps them to reduce their anxiety, depression, and also stress. Sitting up in chair 30 minutes 3 times daily. Walking in room 1 to 2 minutes 3 times daily. Walking in the hall 25 feet or walking through the house, slowly progressing to walking outside the house. Saving energy to return trip. These activities should be done gradually. And also, as you know, hazards of bed rest, especially among elderly, are dangerous. For example, they get deep vein thrombosis and also cardiovascular and pulmonary compromise, and also even about gastrointestinal difficulties. They get this. And appropriate progressing prevent our exercising. By our exercising, the heart and also pulmonary system uh, maybe have some problems like chest pain, palpitations, dyspnea, and so on. Encourage range of motion and endurance exercises. This helps them to strengthen muscles and helps accomplishing daily activities. Provide emotional support and positive attitude. It will appropriate supervisions enhance their confidence. Emotional support, positive attitude, progression helps them to progress every day, and maintaining these attitude, positive attitude, emotional support is more important. Provide the patient with adaptive equipment as they need it. For example, about crutch, about walker, and so on. It helps them to obtaining their independence in self-care and also conserving their energy. So we reached the education for activity intolerance. The nurses have a rule to educate patients and caregiver before they discharge from the hospitals. So first of all, they should teach the patient and caregivers about the signs of physical overactivity. For example, if they have uh, about physical overactivity like dyspnea, like chest pain, and severe weakness, fatigue, and so on. If they have enough knowledge, they promote their awareness and give they give them a knowledge when to reduce their activity. When the patient is hospitalized, arrange the family to bring ambulation aids like walker can. This is more important because patients when come to the hospital, they should maintain, preserve their activity. Another teaching and uh, education is teach the importance of continued activity at home. This is more important because consistent activity maintains strength, range of motion, and endurance of patient to do daily activities. Assist in assigning priority to activities to accommodate energy level. This is more important because, as I said, prioritize the activities is more important, and they have some daily activities. It is essential. They should be done first daily, the more daily activities like, for example, going to bathroom and eating food and so on. After that, they can do another activities that they are less important. Teach energy conserving techniques like sitting to do tasks or changing position often, pushing rather than pulling, using wheeled carts for laundry, for shop, and so on. About sliding rather than lifting, walking at an even pace, not fast, not slow. This helps the energy conserving techniques. placing frequently used items available. They should be available and it conserves their energy. Resting for at least 1 hour after meal and 1 hour before activity. Organizing a work schedule. These items help patients to reduce oxygen consumption and allow prolonged activity. The last slide about education is teach appropriate use of environmental aids like bed rails, elevating head of bed while patients get out of bed, chair in bathroom, hall rails, and so on. These aids conserve energy and also reduce the risk of falls. Teach range of motion exercise and also strengthening exercise. The exercise promote venous return, help the cardiovascular system and pulmonary system, prevent contracture in the joints, and also maintain or increase muscle strength and endurance. Encourage the patients to verbalize concerns about discharge and home environment. The verbalizing can help the patients to reduce their anxiety and also fear, as well as open a door for ongoing communication. Refer to community resources as indicated. If there are some community resources like rehabilitating centers and so on, we should refer the patients because continuity of care is more important for getting the results. Okay, friend, thank you so much. I hope get the notes of this presentation, and also if you have any question, please share with me, and I try to answer it based on the authentic references. Have a great time. Bye.